Good afternoon, Port Harcourt. Yeah, it's good to be back home. It's been a while. My name is Nsirim. I'm a doctor, or I should better say I studied medicine. I'm not exactly sure I'm a doctor. I work in public health. Not used to this. Uncle Hakim, did you put it off? Okay. So while they're sorting that out. Yeah, I work in public health. And I'm going to be talking about where we are in health. That's a lot to talk about. So I'm just going to take a section of it. I'll be talking about a healthier world that has less drugs, less medicines inside of it. Okay, thank you. We said on at the point, here or there? All right, so I want to start by describing an experience that happened when I was 7. The first day I reported to the NYSC camp, the first thing I did was to go, I just met up one of the policemen in camp. So I asked, where's the bathroom? I didn't see any toilets near the hostel where I had moved into. So I was looking around, and then as I saw this policeman, and I'm like, where are the toilets for the camp? And then he looked at me for quite a while, and he really looked at me, and was like, waiting they worry you. Waiting you they form. All this bush here, no be toilet. I better carry that, your younger come out here. And so it turned out that for the entire NYSC camp, with thousands of young people, there were no toilets. So of course, Nigerians, being as creative as we are, the cassava farm behind our hall lost its function as a cassava farm and became our toilet. And so the first week it was okay, when you walked in to the farm, okay, you could see your friends, squatting. You hail him. When you find your own space, you squat, and you guys gist. And then we'll finish, and then we get the bucket, go to one well with brown water to take our bath. It was okay the first week. Now, by the second week, it wasn't as okay. If you stepped out from the hostel to the field, never mind the smells, you had to step that way, then step again, and then look around. So, okay, there's some space over here, and then you squat. So towards the end of the second week, the cassava farm of blessed memory was full. Now at the same time, I was, now who they turned this thing? Not me? Okay, so it's me, right. So by the end of that second week as well, as the bushes around the camp, became full of feces, illnesses in the camp began to increase as well. Like I said, I was one of about 17 doctors on the camp, about 5 pharmacists, a number of other health graduates working in the camp. We began to see a lot more admissions. And the first week, we had only very few people who had allergies and a couple of lazy malingerers who didn't want to go join the jogging and all of that. But by the second week, people had started falling ill, and to us, it wasn't rocket science. There was poor sanitation and hygiene on the camp. It was going to breed illnesses. And to make matters worse, we had no drugs in the camp. We had very few medication, and here we were having a series of infections and not enough drugs. To cut a very long story short, we lost a core member. He died of typhoid fever. He didn't die on camp. When it became clear that he had typhoid and we didn't have the antibiotics to treat him, we entreated on the camp officials, and the best they did was to ask him to go home. We couldn't even refer him to the nearest Federal Medical Center. Now, what happened in that camp is a mirror of Nigeria. We look at illness only on the day when someone shows up at the hospital. But there are several factors responsible for people being ill, and there are actions that we can take, at higher levels before people get ill and show up in a hospital. Right, now, the WHO says if you are born a Nigerian, you are likely to live to be 52 years old as a man and 54 as a woman. That's unfair. Why do women have 2 years on top of us? I really don't know. Yeah, but that's our life expectancy. It's terrible. Now, I just wanted to compare us with some other countries around the world, particularly the Scandinavian countries. You could add to this list the likes of Switzerland and Japan, and Monaco, who have very high life expectancies. And what are they doing? I know you will tell me they have better hospitals, they have more qualified doctors, they have more equipment, and of course they have more medicines in their facilities. That may be correct, but it is not enough to make the difference that we have. Now, the WHO says these are the commonest illnesses that kill people in Nigeria. You could generally classify these into two groups, infectious diseases like malaria, respiratory diseases, and HIV and diarrheal diseases. And that's what we are known for. In sub-Saharan Africa, we have a huge burden of infectious diseases. But there's also been recently an increase in non-communicable diseases, like the cancers and the strokes and all of that are also rising. And the WHO is talking about what is now known as the double burden of both infectious and non-infectious diseases. Now, if I asked anyone, how do we solve these problems? How do we stop this from happening? These are where we are solutions, These are what the average policymaker will think of. Build more hospitals and health centers, train more doctors and nurses, pay them better, okay? Equip our hospitals, increase funding to the health sector, and buy more medicines and more medicines. It's like telling me that if you were in that NYSC camp where I was, the solution to the problems we were having of people getting infected and coming to the hospital was to buy more antibiotics for the hospital. Do you understand? Was that the solution? No, it wasn't. And so we need to think beyond these type of interventions to interventions that make a difference at a higher level. We talk about social determinants of health, those other things that don't look like health, but which are actually responsible for having a huge impact on health. And we as a new generation of people need to be thinking differently. We need to think the way people in Scandinavia and other developed countries think, and not wait for the problem to come, and not wait for the day someone stools and stools until he's so weak and about to die. What do we need to do to stop him from getting ill in the first place? Now, I'm going to look at a couple of interventions. They change again, though. Right? And focus on these. Just a few. I know we all know about exercise and nutrition, so I'm not going to bother myself about those two. Let's look at green spaces. Last year, I was supervising a project in Warri, in Delta State generally, so I used to shuttle between Abuja and Warri, and I will come, stay for a couple of weeks, and go back. And so there was this particular period, work was tough. I was leaving the hotel in the morning, coming back in the night, and I did that for 2 weeks. I was stressed out. So by the end of the second week, I called my friends in Warri, and I'm like, I need a place to go and exhale. I need an open space, a park, somewhere to just commune with the trees and the grasses. And the first friend told me he's not aware of any such place in Warri. Then I called one of the staff I work with, and I'm like, there should be, even if it's a primary school field, something open to the public where I could just take a stroll. And then he laughed and said, bros, now what do you do? It was that kind of space day. I go for it for don't buy and says. And I began to understand why, I was getting agitated. Do you understand? I was tensed, I was stressed, and there was nowhere to just take a walk. And I began to understand, why people in that town, which is not far from where we are, okay, there's this level of unnecessary agitation, and it's affecting mental health, it's affecting people's daily relationships. Green spaces do a lot to health. Some of us here who've lived in other parts of the world can tell. In fact, I was trying to look for studies, okay, to see the impact of green spaces on health. And I'm going to ask all of you to do the same. There were literally tons of studies, tons of evidence showing that when people moved from a place full of buildings, to a place with a green space, their level of wellness generally improves. People just get less sick just by having access to a park. There's a particular study from the University of Exeter in England where they studied about 17,000 households over a period of 5 years. And they were able to prove from that study that people were, a lot less likely to be ill. They also found out that people who were hypertensive, just by walking into a park, lowered their blood pressure without exercising. Now, of course, the other thing the park does is that it affords people the opportunity to, carry out some physical activity, running, jogging, even walking. And all of these contribute to improved health outcomes. Now, if we are to have a healthier Nigeria with less need for medicines, we need to have more green spaces. This town used to be called a garden city once upon a time. We grew up looking for the gardens, and I don't know, are they back now? But we have to bring them back. We have to have green spaces, woodlands, whatever, where people can just go and commune with nature. The other thing, of course, that goes without saying is where people live. Now, look at this picture behind me. The one on the left is a picture of the famous slum, Makoko in Lagos. And the one on the right is a housing estate in another part of Lagos. And I'm just going to ask you, between people who live on the left and who live on the right, who are more likely to have tuberculosis? Who are more likely to have diarrhea? Why? Because naturally, when people live in slums, they don't have access to safe water. Their hygiene is terrible. Okay, what kind of toilets do you think people who live in Makoko have? It's probably in the same, water sources from where they bathe and cook, or stuff like that, or even drink. And so it also goes without saying that if we are to have a healthier Nigeria with less need for the medicines that we don't have, people need to live in healthier places. There is no nation with the number of slums we have that will ever be healthy. It's not possible. I'm just going to ask, what quality of life do you think people in Bundu Waterside have versus people who live in GRA? Do you think it is possible for people who live in Waterside to be healthier than those who live in GRAs? No, because of what we're talking about. You don't have good water, you don't have proper sanitation. UNICEF says about 39 million Nigerians also defecate in the open. Now, only about 28% of us have access to proper toilets. Now, that's a shame. As long as we have such shameful statistics, people will keep getting ill. We will still have need for drugs and more drugs that we don't even have. And so we need to have this change in our thought, that it is not in more hospitals or in more doctors. It is in implementing these other kind of interventions. We don't need to have slums in a country like Nigeria. And we need to understand that the existence of slums really is not just hazardous to the slum residents, because sometimes we build walls. I used to stay in Amadiama in a small estate like that. It was neat. But the next plot to our estate was abandoned, so it became, this sort of Bacha village and a very dirty place. But we had a fence, so we thought, we were immune, okay, from what people in those slums will have. But when the smells began to cross over, do you understand? When we started having the same sort of illnesses they were having, it just tells you that we cannot say, oh, okay, it's them, the slum dwellers. We all have to put hands and heads together and ensure that people have decent housing across this country. If not, we'll need more drugs, more hospitals, more medicines. The next thing I want to talk about is vehicular traffic. In many parts of the world, we're discussing this morning backstage about greenhouse gases at some point, and talking about carbon footprint. In many developed countries, cars are no longer that sort of status symbol thing, okay? They are contributing to greenhouse gases, they are contributing to air and sound pollution. If we are to have a healthier country, we need less cars on the road, which means that we need to work towards having better public transportation infrastructure. You and I should feel very comfortable coming out of our houses, stepping into a bus, join up with a tram down the road, or maybe a monorail, something like that. Now, you see, when there are fewer cars on the road, you have less air pollution. Less air pollution is less respiratory diseases and less need for drugs. Talk about even sound alone, the sound pollution. In this country, I think we honk the highest on the planet. You are driving and you see your friend, so you honk to hail him, okay? Then, there's a traffic jam. I mean, the jam's been there for 30 minutes. You want to exhale, so you honk. It's not moving, but you just have to honk. Then it begins to move, and the guy in front is not moving fast enough, so you honk so that he can move. And all of these, add them to the slamming the doors, and to those who do boom, 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 as they are driving, add the screeching tire sounds, we have illnesses. That's the truth. It impacts on our quality of life. And so the fewer cars we have, people who live in, this is Lagos, people who live in places like this will have, a lot of stress and tension. You are angry already by the time you get to work. You're going home, you're upset because you've been on the road for 3 hours, okay? Forget the pollution, just that alone. And so to have a healthier nation with less medicines, we need less cars on the road. And finally, we need less human beings. This is a picture from Abamoro's immigration exam. Now, just look at that. These guys came to write exams for job opportunities that we are not sure are there. We are not that the job opportunities are few, we are not sure they are there. Now, the population in Nigeria, we hear the growth rate annually is about 2.8%. It's unsustainable. I mean, it was just like yesterday we did the census at 91 that says we're 88 million. I was in secondary school then, and then now we're estimating 170 million. We can't continue chasing China like this. The resources are not there. And what happens is that the more people fight for the same few resources, the more stressed up everybody gets. Okay, now take a family for instance, all right? Take a couple, a husband and wife. Take the average low-income earning family in Nigeria. Let's say 2 of them together earn 200,000. Income per capita is what for those 2 people? It's 100,000, isn't it? Then they have the first baby. The source of income has not increased. They're still earning 200,000. Income per capita has now come down to about 70, isn't it? Then they have the next baby. They're still earning the same thing. Income per capita is now 50. So there is more pressure, and all of these affect mental health, they affect general wellness, and that is why in some parts of the country, there will be that child who will be born at the time when the socioeconomic balance of the family collapses, and then they brand that one a witch. Now when them born am, now everything just scatter. And so if we have to have a healthier country, we need to take active measures to reduce our population growth. We cannot continue like this and not be needing drugs and more drugs. Actually, I don't finish. Thank you very much.